I'm a volunteer, like most of us in Healthcare for All Oregon. We're a nonprofit 501c4, and we also have the Healthcare for All Oregon Education Fund, which is a 501c3, and I'm on the board of actually both organizations that are related. And so I'm a volunteer. We have two paid staff now, but for a while we've just had only one paid staff, and we're mostly run by volunteers. And basically what we are is we are the state organization working on bringing Medicare for all, or you can call it single payer healthcare, the kind of healthcare that we have in Canada, Taiwan, and similar to many other systems that exist throughout Europe. And the main difference is that it takes the profits out of the healthcare system and gives individuals choice to see any licensed providers. So rather than being stuck with the narrow network and trying to make sure that you only see the providers within your network, you'd be free to see any licensed provider and not have to worry about that, not have to worry about billing. And as we could see with other countries, when countries have these kind of systems that are much more efficient, it also saves quite a lot of money.
It makes you kind of wonder, well, is it just a profit motive that keeps this from happening? The profit that's coming out of our pockets and going into the healthcare industry, and then it's turning around and some of that's making its way into the pockets of the legislators.
Sure, absolutely. That's a major part of it. And I mean, but that's a big part of it. But at the same time, we are supposed to be a democratic country, and so a big challenge for us is to do the education, grassroots education with the people, and inform the people about the problems with our current healthcare system, even with the changes that have happened with the Affordable Care Act, and also inform people about what this different system is like. And really, people have some understanding of Medicare, and actually from all the polls that we see, whether polling from local here in Oregon or throughout the country, Medicare polls very positively. And it's unfortunate that even though people know that Medicare is good and can rely on Medicare, people misunderstand what Medicare is, and hence we've had those famous or infamous statements of people that were protesting when the healthcare reform was happening, saying, "Hands off my Medicare." Right? Government hands off my Medicare. Well, Medicare is government single-payer healthcare system, where so let me back up a little bit and explain how healthcare works. So we can think about healthcare in terms of the healthcare financing and then the healthcare delivery. So you could think about it as the insurance and then the actual care. And so what Medicare does is makes the government the single payer of the insurance, so government financed, but the delivery is still the same delivery that any of us in the U.S. sees private practitioners that are licensed practitioners. Granted that, someone like me, I work for Portland Public Schools, and we have very good health benefits for which we've had to sacrifice our pay. I remember over 10 years ago, we had to take a pay cut of working for free for 10 days. In order to be able to maintain our health benefits, but that means that our health benefits have cost a lot, and the total premium for a full-time teacher last year, I'm not sure what is this year because I work half-time now, but last year was over $18,000 a year. Woo. So that's just to pay the insurance. And then if you actually need any care, depending on the care that you need, those are very good benefits. And for medical care, it covers most things. But for dental, still, I was trying to get as much dental work done as possible before I, shifted to half-time insurance where I don't have dental and vision anymore. And I discovered that after one filling and root canal, I maxed out. And even with that one filling and root canal, I had to pay 20% of the cost. So I I paid like over $1,000 out of pocket after the taxpayers paid $17,000 towards my health insurance, and then I paid out of my pocket towards my health care premium about $1,300, and another $1,000 out of pocket for deductibles, and then I was maxed out. So the next filling or crown that my dentist was recommending that I needed would have been 100% out of pocket, even though I had insurance. So, I think, I've kind of lost my train of thought. But
well, you were talking about it being a two-part thing.
Oh, yes. So the paying for the health insurance is not the same thing as being guaranteed the access to the actual health care. And we can see that whether it's now or even before the ACA, the number one cause of bankruptcy in the United States has been medical costs. And the majority of people going into bankruptcy are people that have had health insurance. So even with health insurance? Even with health insurance. And there definitely have been some improvements with the ACA, or what people call Obamacare.
On the lower end of the poor people, but it hasn't helped middle class that much.
It's been, in some ways, it has helped to some degree, and let me just explain that a little bit. I mean, as far as those out-of-pocket costs, it did put a cap on out-of-pocket costs, so that the out-of-pocket cost for a single person, I believe, is $6,000, and for a family is $1,200. So once you reach that limit, the rest is taken care of.
That's important.
But that's a big limit. I mean,
it is.
What that means, that deductible means, and especially like what you're talking about, for people that can't afford the gold plans, a lot of people, the only insurance they could afford are what's called the bronze plans, and those come with very high deductible. So what the deductible means is that they have to first shell out $6,000 out of their own pockets for their medical care before a single penny of the insurance kicks in to cover their care. So we end up with a situation where people are paying their health insurance, and then they're afraid to actually use their care, because to actually use their care after they pay the health insurance, $100 a month, $200 a month, whatever it is, they have to actually pay, thousands of dollars out of their pockets before they get any benefit from the health insurance.
By benefit, do you mean before the doctors will even work on them?
Anyone could always see the doctors, but before the health insurance will pay a single penny to the doctors to give them actual care. So what ends up happening is that it means that a lot of people, even when they have this kind of health insurance, they're not going to see the doctors to actually get the health care that they need, and we will still have health problems. And it also means that it keeps us stuck in this inefficient system where people will wait until their health problems become really huge and even much more costly and much more problematic. Then they'll have no choice to do that. And granted that we're facing record inequality and poverty right now, even a $6,000 or $12,000 deductible could mean, someone becoming homeless, completely broke, or even bankrupt. So, while it's better than before, where people were, paying $200,000 even when they had insurance, because the insurance wasn't covering things, it still is problematic. And actually, the industry finds all kinds of ways to, keep making their profits. So another problem that has been documented by news groups like ProPublica is that they find that sometimes patients, without their consent, while they're passed out in the middle of surgery, have a different specialist that's out of their network come in and do part of the procedure. So even if you have insurance, and even with this out-of-pocket cap under the ACA, if someone's out of your network, it's not covered at all. And same thing is, if you have an emergency and you get sent to the hospital, and you get sent to the wrong hospital that's out of your network, it's not covered at all. And no matter how much they say that you owe them, $500,000 or whatever, it doesn't matter whatever the cap is, because that cap is only for your insurance company and
the
provider.
network.
So it really means that, under this capitalist healthcare system, people really have very little choice. They're stuck with a few choices for big insurance companies and HMOs, and then those insurance companies and HMOs require that they see only some providers, and unlike other countries where people really have much more freedom. And granted that, it's even kind of a joke to call this a capitalist system because for healthcare, because there's no transparency. People have no idea what different procedures cost. And in fact, we even know that the same procedure within the same network, depending on what city you're in, cost drastically different prices or between one provider or another. So it really is an example of the worst example of the market not working to provide really what should be a public good.
Sure. Well, besides transparency, I mean, capitalism is supposed to be based on competition. And though there may be competition between different HMOs and hospitals, the competition, I think, is more superficial, it seems like to me. There really isn't a lot. It's locked in. Well, listening to you talk, it just seems to me that it's pretty obvious that the single-payer healthcare is something that the time has come. And if the insurance companies or whoever, or the hospitals or whatever, whether the single-payer is paying through the government or through insurance companies, they still get their money. Why is there such a hue and cry about doing it this way?
Well, I mean, basically, having single payer or Medicare for all would put most of the health insurance companies out of business.
Oh, so it's insurance companies, not the healthcare providers then?
Yeah.
Right. That clears it up real well.
Well, it's a little bit of both, because especially the pharmaceutical industry and the medical supply manufacturers, the ones who really make a big profit, know that under an efficient system like they have in many other countries,
civilized countries,
there's no way the government would pay for their crazy profits, so that they know that their profits would either be eliminated or would be drastically reduced. So there is opposition from beyond just the health insurance industry, but definitely the health insurance industry. And let me back up a little bit and just say again, let people know how they could find out more. Our website for Healthcare for All Oregon is www.hcao.org. And you can find lots of information. And let me also just mention really quickly that we have a rally coming up in Salem on February 11th. That's this Wednesday from 11 to 1. And we're going to have speakers, including doctors, nurses, providers, people from all kinds of backgrounds talking about their own healthcare stories, and also musicians like I'm blanking out on some names here.
He was there a couple of years ago.
Yeah, but great musicians, everyone from David Rovick to...
David, sure.
I'm trying to remember the name of...
This African-American gentleman?
Norman Sylvester. Blues legend here in Portland.
Yeah.
And Weiss, so... Bajo Solario, so many different musicians as well, talking about their own experiences and playing music that highlights human rights issues in healthcare. And our fundamental thing with Healthcare for All Oregon is that healthcare is a human right, that it should not be something that people make profits off of. This is something that we have the ability and the resources to provide for everyone, and there's no reason not to do that. But I also want to talk about a lot of other issues because, for me, it's beyond just the human right. It's really a way of addressing, one important way of addressing many deep economic problems that we're having right now. Like we were talking about earlier with poverty and inequality. Just for one example, the way that the federal government calculates poverty rates is basically on the cost of food, and it's from an outdated calculation that they came up with in the 50s.
Yeah, I've heard about
and
this,
it doesn't factor in other kinds of costs that people have to deal with. And if you look at, for example, this, viewers probably can't see this, but if we look at this kind of data from 1980 to 2009,
you can hold it up there to that camera there. Just
healthcare costs.
hold it up like you were there.
Okay. Healthcare
No,
costs
just stay seated there.
Okay.
There you go. Boop.
Yeah. So compared to food costs, which has gone up, 151%, electricity costs have gone up in a similar way, but healthcare costs have gone up over 400%. And also tuition costs have gone up over 700%. So many people are struggling to pay not only for their food, and with globalization and things like that, electronics, a lot of things are cheap, but cost of healthcare, which is absolutely necessary, has gone up so much that if we factor those kind of costs in, the poverty level in America would be much higher than it is. And I think from what I remember from a news article analysis just about a month ago, the poverty level would be something more like 51%. So,
and what is it now?
It is, depending on the place, between 15 and 25%. And also, then there are other calculations about how close people are to poverty. If you count that, it's much higher as well. But whether we can cite statistics or not, I think just people know just from their living experience that inequality and poverty, and not only poverty but stagnant wages for middle-class Americans as well, has been a huge problem. And speaking of stagnant wages, whether we're talking about for working class or middle class, or myself, as a teacher, workers have been basically begging to get tiny little cost of living increases.
If they're lucky.
If they're lucky, and not even every year, right? Every so many years, you might get like a 2% increase, 1.5% increase, something like that. Meanwhile, what's happening with healthcare? In Oregon alone, I forget what the time period is, it might be the last 20 or 30 years, it's been increasing every year at a rate of, at average of 6%. So imagine
healthcare costs.
Yeah, healthcare costs. So imagine if our salaries or wages had been increasing by that much instead. I mean, granted that not all our salary is paying for healthcare, but still a significant chunk, like I explained, mine does. If we figure that into really our health insurance costs are part of our compensation that are being really stolen from us, that are going to the 1%, that are going to even nonprofit HMOs like Kaiser, where they package the provider and the insurance to be more efficient. Even they are making a profit of over $2 billion a year, and they're supposed to be a nonprofit. And meanwhile, whether they're a nonprofit or for-profit, the CEOs and the executives are making millions of dollars a year. Then you have all these administrative staff that are just do nothing to actually provide any care to anyone, but that do this billing, right? This billing that's completely untransparent, that is all about just, it's a racket, right? Just squeezing money out of the people that really should be going to our compensation to be one important part of countering this stagnant wages and salaries for working Americans.
Well, what you're saying, it just makes a lot of sense, because that's one of the many reasons why the wages have remained the way they have, because all the money is being pushed up towards the top, towards the 1%. I mean, they say that wages have remained stagnant since basically the 70s, but CEOs still get their millions of dollars a year.
Yeah.
And I imagine some of those CEOs that we read about getting that money, some of them might be working in the healthcare industry.
Oh yeah. Yeah.
It just seems to me that I know you work for the school, and it just seems to me that is probably one of the main problems with the school districts is there's so much administrative people, and then they're the ones that set the money that goes to the teachers and all that, and their own as well.
Oh,
and
yeah.
so the administration of these in these different businesses have a throttle hold on what's going on down on the ground level.
Yeah, I would love to come back another day and we can talk about the schools and administration too. Yeah, absolutely. That's a major issue.
And I talked to Lee and he set this up. He had a little 90-minute clip, a 90-second clip he wanted me to play.
Oh, yeah.
So let's play that and then we'll come back and then we'll had about 4 minutes to finish up.
All right.
It's going quick.
Now's the time to finally realize we the people must make some choices. If we want health care for all, now's the time. Now, raise our voices till they hear us in the halls of government and behind each corporate door. That we're sick and tired of getting less and less while paying more and more. Put human need before corporate greed. Join with many doctors, nurses, and other concerned Americans who believe health care is a right, and without health care for all, there is no liberty and justice for all. Let them hear us. Health care for all, because health care is a right. Health care for all, and the U.S. saw the light. That every woman, child, and man should have health care in this land. Now's the time to finally put it on the table. Contact your legislators and neighbors and tell them to support health care for all, because health care is a right, and our interests are special too.
All right.
Health care for all, because health care is a right. Health care for all, and the U.S. saw the light. That every woman, child, and man should have health care in this land. Now's the time to finally put it on the table. Now's the time to finally put it on the table.
All right, we're here with Hyung Nam with Healthcare for All Oregon. We got about 3.5 minutes, so where do you want to go to from here?
Well, I should just follow up with that and just encourage people to go to the website, and either the website that you saw there or just hcao.org, and you will find links not only for more information, but for the rally. We have links for signing up for buses, and we chartered several buses, and there are some scholarships, I believe, as well that people can get for the cost of the buses, and or also sign up for carpools. And for people that can't take the day off of work on Wednesday to go down there, or people from farther away from farther out from Salem that have a difficult time traveling there, you could also participate in ECHO events. And if you look on the link and look for ECHO events, you'll see how you could virtually participate and send photos in, basically a photo petition, and we will gather all of those and send those to your legislators as well, and send the message that Oregonians want real universal health care that that will not deny anyone for health care, and that will also improve our economy. And I just want to say a few more things about that as well.
Sure, you have a little over 2 minutes here, so.
Yeah, so one other thing is, if we think about employers, I mean, not only for workers, but also for employers, it's a huge cost. The rising healthcare costs.
Right.
And, I think especially employers, there are some employers that know what it's like because they're, whether it's Intel or Nike or whatever, they do business in the Netherlands, they do business in Canada, they do business in the UK, and they know in those other countries what they pay for their taxes for their employees, rather than paying healthcare premiums, is much more affordable and predictable than paying the kind of healthcare premiums that they have to pay here, which is especially to attract high salary workers, are very expensive benefits. And so this would not only help our economy and workers, but it would attract businesses to come invest in Oregon and do business in Oregon, because their healthcare costs would be much cheaper. So, another thing is that we have many small businesses that support single payer and healthcare for all Oregon, because they know that, especially for smaller employers, paying healthcare costs are so expensive. I mean, I grew up with my parents being self-employed, and we grew up without insurance because they just could not afford it. And even with the changes with ACA, it is still not enough for people to really afford not only the insurance but the actual health care that will make people healthier and for us to have a healthier society.
Mm-hmm. Well, thank you for coming on, Hyung. This has been very clarifying to me, and we'll do this again, and maybe we'll take a whole hour and be able to talk about it a little more.
Great.
But while we were talking about all this, it reminded me of a little postcard I saw one time. It was a reporter that asked Gandhi, "What do you think of Western civilization?" He said, "I think it'd be a good idea." And this would be a good place to start.